If everyone is ready, I'm going to start inviting participants to join now. Are you all set?
Yes.
Great. Okay, thank you.
Sophia, someone's introducing all the panelists, right? Or is that it wasn't clear to me.
Yes, Sophia is the host today, the EPIWIN host today.
Perfect.
She is introducing everyone.
Wonderful. Thank you.
And then when I hand it over to April, then I think April will invite everyone, all the panelists, to the discussion for Q&A. If that makes sense.
Okay,
I
we're starting now.
got it, Sophia. Makes sense.
We'll start in a couple of minutes to allow more participants to join. Good afternoon, good morning, and good evening to everyone. We welcome you all, particularly those of you joining from far away or at late or early times. Thank you for joining this WHO EPI-WIN mpox series webinar on being safe at home, IPC and WASH measures for home care and isolation for mpox in resource-limited settings. For those of you new to EPI-WIN, this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. Our goal is to translate science in accessible, understandable, and relevant ways for evidence-informed actions and decisions in health emergency preparedness and response. Today, we have a great panel. The distinguished speakers will be Sam Boland, Incident Manager of the mpox response at WHO AFRO, Victoria Willet, IPC and WASH unit at WHO headquarters, Pierre-Yves Oger, WASH and IPC at UNICEF, Lester Geroy, Community Readiness and Resilience at WHO HQ, April Baller, IPC and WASH unit at WHO HQ, Janelle Franklin from US CDC, Margaret Montgomery, WASH at WHO, Andre Bulabula from Africa CDC, and William Carter from International Federation of Red Cross and Red Crescent Societies. I'm Sophia Song, and I will be moderating today's webinar. Before we begin, there's just a couple of items for housekeeping. This webinar is being live streamed on EPIWIN YouTube channel. The webinar is being recorded, and the recording will be available from our website. The address will appear in the chat. We invite you all to post your name, location, and organization in the chat box. We would love to hear where you're joining us from. And please add any questions you may have to the Q&A box, not in the chat, so we can more easily keep track of them. Now, before I hand it over to Samuel for the welcome remarks, we will first start with a Slido question to understand you, our audience, a bit better. So please either scan the QR code or go to slido.com. with hashtag 2874369. And we will wait a few minutes. So in your community, are people with mpox being isolated at home or in a health facility? Okay, so far it looks like majority of the respondents say in a health facility. Okay, and that percentage is increasing. So I think, yeah, now we will keep the Slido open so we are able to receive more responses. So yeah, it looks like more than 2/3 in a health facility. Great. Yes, so we will now stop sharing screen, but please continue with answering the Slido question during the course of the webinar. Okay, great. So now I will now hand the floor over to Sam Boland, Incident Manager of the mpox response at WHO AFRO, for the welcome to this EPI-WIN webinar. Samuel, the floor is yours.
Thanks so much, dear Sophia, and hello to everyone. Good morning, good afternoon, depending on from where you're calling in. It's a real pleasure to welcome you today to this session on this new interim guidance for IPC and WASH measures for mpox care in the home. And as the mpox incident manager for the World Health Organization Regional Office for Africa, I want to extend my appreciation to each of you for joining us and your continued commitment to supporting our communities through responsive, tailored care, especially in the face of limited resources and other complex challenges. Mpox remains a serious public health issue requiring our full attention and dedication, particularly in the African region, where it continues to impact communities profoundly. Your ongoing efforts in managing and mitigating mpox are critical to protecting the health and well-being of those affected, and I want to thank each of you for your hard work. This guidance has been designed with practical measures at its core, aiming to provide realistic and actionable steps for settings where resources are constrained or where health facilities may be out of reach. And in these settings, isolation at home may be the only feasible option. And it's precisely in these contexts that guidance like this becomes essential, not just as a set of recommendations, but as a tool for leaders and community members and caregivers who work tirelessly to manage and contain mpox effectively. We know that adopting, adapting, and implementing this guidance will vary significantly across our diverse region, as countries face unique challenges and also have different capacities, as well as unique local concerns. Our goal is to support all member states in applying IPC and WASH practices that meet their specific needs and orientations. This commitment of all of those on the call today is reflected in our continued focus on partnership and collaboration, working alongside all countries to adapt and refine approaches that can maximize impact on the ground and ultimately help to save lives. Our priority in releasing this interim guidance is to provide a vital bridge to safe home-based care until we can complete an ongoing review and update to clinical management and IPC guidelines. This update, which will incorporate the latest research and emerging evidence, is expected within the coming months. In the meantime, the practical strategies and preventive measures outlined here enable us to act without delay, offering caregivers and households critical tools to manage infection risks effectively. To support these efforts, there will also be the release of a standard operating procedure that accompanies this guidance, and that will address specific areas, including step-by-step protocols to help use this guidance and make sure that that guidance is shared with those who need it. Today's session ultimately is a critical opportunity to ensure that this guidance is not only understood, but also can be used to become operationally feasible across the diverse settings in the African region and elsewhere. I encourage each of you to share your insights and also any anticipated challenges in implementing these measures. Together, our discussions can enhance the impact of this guidance, making it adaptable, effective, and context-sensitive as possible, and again, ultimately, to be there to help us protect lives. Thank you once again for being here, and I look forward to a productive discussion. Back over to you, Chair.
Thank you very much, Samuel, for your welcome remarks and for highlighting the critical need of the guidance. Let me now invite Vicky Willet from WHO and Pierre-Yves from UNICEF to tell us about the WHO IPC and WASH home care and isolation package.
Thanks so much, Sophia. I'm not seeing my slides. I just see myself. Okay, great. Thank you so much. That's helpful. And thank you very much to Dr. Boland for those really important remarks emphasizing the significance of the mpox emergency and the potential impact this document could make. So I'm going to walk through the document rather quickly so that we really have more time at the end for discussion with our panel. So the objectives of today's webinar is to describe this document. It's a WHO IPC and WASH guidance for home-based care and isolation. And in particular, we're focusing on low resource settings and with the goal of providing some other ways you could potentially implement the principles of IPC in settings where perhaps the resources are not easily at hand. So next slide, please. And of course, in order to start, we have to make sure we all understand how mpox is transmitted, because this is the core foundation for how we implement the infection prevention, control, and WASH measures to prevent that transmission. There's animal to human transmission, where you have contact with an infected animal, which could be touching them, a result of bites or scratches, or perhaps when hunting or preparing animals to eat. And then we often see from there human to human sustained transmission. And that can be from skin to skin, so being in contact with the lesions through touching the lesions or sexual contact, mouth to mouth or mouth to skin, such as kissing, and face to face. So if someone has mpox and you are very close to them while they're speaking to you or breathe, and they may have sores in their mouth or some other things happening where you could therefore be transmitting the mpox virus. Next slide, please. So the IPC and WASH team at HQ has developed a strategy for mpox, and we sit within several different clusters at the response level. Our team sits within safe and scalable care, and we also sit with the enhanced community protection cluster. And that's what we're focusing on today, on strengthening IPC and WASH in home care and in community settings. But today we're focusing on the home care element. We also provide cross-pillar technical support, such as points of entries, vaccinations, those types of things. So next slide, please. And today we're focusing on this particular guidance, which was released on October 18th. And in this, we talk about all of the different IPC and WASH measures in order to safely provide home care and isolation for persons with mpox in resource-limited settings. And here on the slide, you can see all of the different sections of the document. And I'm going to walk you through very briefly each of the sections, and my colleague Pierre-Yves will walk you through the sections on the water, sanitation, and hygiene during home care. So we'll get started with the first section of the document, which is critical. Next slide, please. And this is determining if the person with mpox can actually be cared for and isolated at home. And there is an algorithm at the back of the document, this little chart here, where the clinician will need to consider several pieces of information before making that decision with the person who has mpox on whether or not they're safe to be sent home to be cared for. And that's looking at their clinical severity, the complications and risk factors, what their care needs are, and whether or not they actually have access to referral or hospitalization if something changes in their condition. and the availability of support if needed, such as health workers or community health workers, which our colleague, Dr. Lester, will speak to later in the presentation. So this is the first step. Make sure that they can actually be managed safely at home. Next slide. So hopefully you can change to the next slide. And in the meantime, I'm going to, oh, there we go. So then we start talking about the IPC measures for the different people who may be involved in the care of the person. So for health and care workers, and this includes our community health workers, we provide what the actual WHO guidance suggests, which is that they have appropriate PPE, that hand hygiene is performed according to the WHO 5 moments, that the person with mpox covers their lesions and wears a well-fitting medical mask when they're close to the person who's coming in to support them in their care, and that waste is handled as though it was infectious waste and it's managed appropriately. But what if that can't be done? What if there are some challenges or some gaps? Then we provide some alternative options where we stick to the principles of IPC, but provide some suggestions that could be managed in the event that perhaps there is no personal protective equipment. So as a health and care worker, if you must go in the house and you have no personal protective equipment, then we're suggesting don't go in the house. Meet with the person outside, maintain 1 meter distance, or the delegate taking care of them, and have that conversation in a safe space outside. If you don't have your hand hygiene, same thing. Refrain from entering the household and keep a distance of 1 meter. We also provide throughout this document alternative barrier protective measures. So we often talk about personal protective equipment, but in the event that that formal personal protective equipment isn't available, there are other options that we can consider, which we describe and I'll talk about on the next slide. Next slide, please. And here we talk about the infection control for the person who actually has mpox. We talk about that they should cover their lesions. They could use bandages, but perhaps they don't have bandages or they don't need bandages, then perhaps they can use their own clothing. They could just wear a long sleeve shirt or wrap something around their lesions, wear long pants or long skirt to cover lesions, and that would work. And we also suggest wearing a medical mask. If you don't have a medical mask, then a fabric mask would suffice. So we offer lots of different options throughout the document to consider implementing when you're looking at home care where perhaps you don't have everything that you would ideally need to be managed at home. Ideally, the person should be separate from others in their own room, but if that's not available, there are some things that you can try to keep separate, where you can designate the space within the household that person would remain in and try to manage their care within that specific space. So there's a lot of different options you can see in the table, which I know you can't see it clearly, but it's in the document on some things to try to help implement these measures in the home. So next slide, please. And what about the caregiver? We do suggest that ideally the person that's going home is able to manage their own care, but that may not always be the case. And so in that situation, they may need to designate a caregiver, and that person should be in good health and ideally have either had previous infection with mpox virus or has recently received their vaccination or even their smallpox vaccination previously. Again, if that person is in contact with the person with mpox, we talk about using PPE, and we give, again, the options. If they don't have PPE, you could wear a fabric mask. You could choose a set of clothing that you will use to wear when you're in contact with that person who has mpox. So there's some different options that can be tried to manage their care in the home and interact with that person safely. And of course, we really emphasize hand hygiene. So cleaning your hands with either soap and water or alcohol-based hand rub as much as possible. Next slide, please. Managing the linen and laundry of a person with mpox is an issue. We definitely don't want to be shaking laundry. You have to handle it carefully because there has been incidents where we know there is potential for transmission from the virus being in the fomites in the linen and laundry, and then somebody else handling it and could subsequently be infected. So it's important that it's handled carefully, and we do offer a variety of options for managing that. You can be washed in a washing machine, separate from the rest of the household laundry. If you don't have a washing machine and you're doing laundry by hand, we offer different options where you could use hot or warm water, and you can use detergent, or if you don't have access to a detergent or soap, chlorine solution of 0.05. It's not a strong chlorine, can be safely used as well. And again, we offer options for PPE. Perhaps you don't have formal PPE, but you could use some household rubber gloves when you're handling that linen. Next slide, please. Cleaning the household, we are working on some more materials to support this. The important thing we want to recommend is that spraying households is not recommended. We don't want to see people fogging or spraying people's homes. The people that are at home, the family and or the person with mpox, if they're able to, can certainly do their own household cleaning and disinfection. And that can be done with soap and water, followed by a disinfectant such as a household bleach. And really, they should be cleaning the surfaces that the person with mpox, the space that they're in daily, and then clean the household once that person no longer has mpox and is coming out of isolation. In terms of PPE, you can use the PPE if it's available, and our UNICEF colleagues will speak a little bit about that. Or you can use alternative barriers such as household rubber gloves, a fabric mask. You need a bucket and some cloths, and ideally don't sweep, but damp mop floors if that's an option. And next slide, please. And when the time comes that the person with isolated can be taken out of isolation, that's when their lesions have all crusted, the scabs have fallen off, and they have nice new skin being formed underneath. That is when the person can be taken out of isolation. And at that point in time, everyone in the house should continue to self-monitor daily for any signs and symptoms for at least 21 days from the point in time where that person no longer has isolation. And at this point in time, this is when it's important to clean and disinfect the household and any bedding that was used by the person doing the laundry. And we do offer a number of options in the document that can be looked at for how to manage mattresses and other surfaces that maybe have been used by the person or touched by the person with mpox. And with that, I'm going to stop and turn it over to my colleague Pierre-Yves to talk about some of the additional water and hygiene measures that need to be taken into consideration. Over to you, Pierre.
Thank you very much, Vicky, and good morning, good afternoon, good evening, colleagues. I'll be fast to keep some time for the discussion, but just to highlight a few key messages related to water, sanitation, hygiene, and waste management. On water first, water supply, we wish to have adequate quantity and quality, what we consider as at least a basic access by 15 or 20 liters per day per person of clean water, but we offer options regarding additional storage in case of issues with availability, and we also propose in that guidance options regarding treatment of water to ensure adequate quality. Next slide, please. Maybe just on water in terms of interventions, we also have some of our partners providing more water in affected neighborhoods. So that is a way to ensure more availability of water at household level. So now moving to sanitation and hygiene. So the idea is ideally for people to access to improve sanitation facilities and to have a dedicated toilet for infected patients. However, we offer options of shared toilets and where we suggest that the cleaning should be performed by the patient, infected person, or by the caregiver wearing PPEs in case of shared toilets. It's the same for bathing area or shower. If it's shared bathing area, the cleaning should be performed by the patient or by the caregiver having PPEs. And then we do recommend, of course, hand washing with soap and water or using alcohol-based hand rub solutions. Next slide, please. On waste management, very, very briefly, but ideally, waste, and specifically here thinking about bandages, PPEs, ideally waste should be disposed of in a sealed waste bag and through the centralized waste collection and disposal system. However, we recognize that it may not always be feasible, so options in that guidance are about burning and bury protected pits, and be sure that we keep the waste away from animals and humans. Also providing guidance regarding appropriate PPEs while handling waste, and be sure to practice hand hygiene. Next slide, please. Yeah, and final word on supplies, and that is part of this annexation, a list of supplies we recommend for household hygiene kits, which were conceived to ensure that people at household level can perform hand hygiene, can perform the cleaning, and can protect themselves in case they are in close contact with the patient. So we have this list of items which is available, and which is the idea is a recommendation is to provide this hygiene kit to any families that would have someone being taken care at home. Next slide, please. And I'll be finishing with this last slide and the few key messages. Next slide, please. So I'll be very short here to keep enough time, but just be sure, as a key message is assessment is very important, and Vicky mentioned it. Children under 5 should be cared in healthcare facilities. We offer options for isolating and a person if a separate room is not available, and we also provide in this guidance recommended measures, alternatives in case all recommended options are not available. I'll stop here. Thank you very much. We'll be happy to answer to any question, and back to you, Sophia. Thank you.
Thank you very much, Pierre-Yves and Vicky, for providing an overview of this important document, and especially the alternative options for resource-limited settings. Next, let's now welcome Lester Geroy from WHO for the next presentation on community health workers. Lester, the floor is yours.
Thank you, Sophia. So as we're waiting for the presentation there, I think you can see it. So I am from Community Readiness and Resilience, and I'm working closely with the IPC team to develop the training for community health workers and community volunteers. The earlier presentation provided guidelines on IPC for the home in low resource settings, and also WASH guidelines. And I know many of you are working in the field. Maybe many of you are frontline workers. Many of you are managing or working with community health workers and community volunteers. So this part will be most relevant to you as you provide advice. Next slide, please. The next slide just shows an overview of some of the things that we will be talking about. It will not be comprehensive, but many of them have also already been mentioned in the earlier presentation. Next slide, please. This slide, the next one, shows the overview of the critical role of community health workers and community volunteers in health emergencies. I'd like to draw your attention on the lower left side, where you can find community health workers and volunteers. We know that they are available and they exist in many countries, and they form a link between communities and the healthcare sector, maybe linking communities with primary healthcare, with the public health office, and even supporting rapid response teams as they're being deployed. In the center of the image, you can find detect, notify, respond, care, which are some of the functions that community health workers and volunteers also do to support the detection and care for cases. And in all these functions, IPC and disease prevention, as mentioned earlier, are needed in all of these activities. Next slide, please. So in the next slide, who are the community health workers or community volunteers that we are talking about? These is an important group, but these are actually quite a lot. Most familiar to us in health are community health workers, but we also have CBS volunteers, community animal health workers, first aid responders, community volunteers, and so on. And many of them have basic knowledge on health, and they have been doing health education, health promotion activities, supporting immunization, and supporting other things. So they're already doing some important functions to support primary health care. And also in the detection and care during the mpox outbreak, we very much need to engage with them. Next slide, please. So as mentioned, community health workers have critical roles, such as providing home visits, educating household members, monitoring practices, community prevention efforts, depending on the country policies and protocols. Next slide. So the contents I'm sharing are actually part of the community health worker, community volunteer training that is being prepared for countries to enhance their capacity and safety for community health workers in the mpox response. Here are some reminders for community health workers and volunteers to protect yourself during an mpox outbreak. Number one, stay informed about the risk of mpox, about the disease. Refrain from close contact. It was mentioned earlier, especially with individuals who have mpox. Do not share items such as bedding, clothing, utensils, and so on. Seek health advice and monitor closely for signs and symptoms. And if you do develop signs and symptoms of mpox, important to use a mask, wash hands, cover the lesions, seek medical care. And of course, important to follow guidance of your healthcare provider or your national public health authority. Next slide, please. So there are other actually reminders and tips and guidance for community health workers that are included also in the IPC home care guidance that has been published. A few other reminders for community health workers: always coordinate closely with the local health authorities and staff in your different activities. Provide compassionate, respectful, and people-centered care and counseling when applicable. Use community organizations to also support education and raising awareness. Work with local health authorities and ensure available PPEs to be used. It's important to have your supplies such as PPEs, alcohol, and so on, and always wear them. Next slide, please. So the next slide shows some reminders that community health workers can also provide those who are isolating at home. In general, it's really overall self-care that should be provided, and you can take a look and even copy the slides. Next slide, please. So the next slide also provides other advices that community health workers can give, and these are all included in the IPC guidance. They include hand washing, cleaning the house, laundry, how to use masks, how to prepare disinfectant. So these kinds of advice community health workers can also provide. Next slide, please. So in the next slide, it shows, I want to emphasize the role of community health workers, community volunteers, actually a lot, especially for mpox and in other public health programs. And they are engaged in many tasks. So they also include community-based surveillance, community health workers, community volunteers also support risk communication, community engagement, coordination at the community, even supporting to provide mental health and psychosocial support. So these are among the many tasks. Next slide. And next slide, which is my last slide, it's a summary of the different tasks and activities of community health workers. So we have listed under community-based surveillance some of the tasks, home care and IPC, risk communication, including infodemic management, mental health, and other activities in the community, including coordination. So in the interest of time, we cannot really discuss all of these, but these are all mentioned and discussed in the training program for community health workers and community volunteers that will be shared with countries. Thank you very much.
Thank you very much, Lester, for highlighting the important role of community health workers and volunteers and how they can support the community during mpox response efforts. Now we will move to our second Slido question, which we will place on the screen shortly. So our second question is, do you work in a setting considered to have limited resources to provide home care for persons with mpox? And it looks like majority of respondents are saying yes, that you work in a setting considered to have limited resources. And I think in this case, the guidance that Vicky and Pierre-Yves have described would really be applicable and relevant for you. Okay, now we're moving to 2/3 saying yes. So let's see if there's any more movement. We have 77 respondents. Okay. So please join the Slido at slido.com, #2874369 to participate in this poll. Okay, I think there not much change now. So we will stop sharing screen, but we'll keep the poll going so that you're still able to respond to this question. And now I will invite April Boller from IPC and WASH unit from WHO to moderate the Q&A session with our knowledgeable panelists. April, the floor is yours.
Thank you so much, Sophia. Can you just confirm you can hear me?
Yes, loud and clear.
Okay, great. So first of all, good morning, good afternoon to all, and really pleased to be here. And I think from the two questions that have just been answered by the audience, it shows that this really is the relevant audience for this document. And we hope that everybody will take this on board and really use it and also to give feedback on how they are implementing it. So with that, we have a great set of panelists from different organizations, and we're really excited and appreciate each of them giving their time to be with us today. So I'm going to ask a set of questions, and in addition to that, the team is answering questions in the chat, so everybody please continue to ask the pertinent ones. So the first question is for our dear colleague, the IPC lead from Africa CDC, to Andy Bolabola. So Andy, the question to you is, based on this guidance and considering each country's unique situation in the African region, what is Africa CDC advising countries for their strategy with regards to home care and isolation for managing cases? Over to you, Andy.
Hi, April, and thank you for the question. I hope you can hear me clear and loud. All right. So for Africa CDC here, this goes with IPC and case management all together. We are actually
and you're gonna have to
countries.
slow down.
All right.
For the translation.
I forgot that, yeah, the translation. Okay, sorry. So for Africa CDC, this case management and IPC unit all together, we are advising countries to consider having home-based care and home isolation, because we have also the awareness that there is limited capacity to admit all the patients in the current health settings that we have. And that is one. And second, there is also quite a number of, or a high proportion of stigma and also resistance from some patients to be admitted into healthcare settings. So this element together really motivates us to advise countries to accept or to consider, at least as an option, to have home-based care and home isolation. Of course, considering that they have the basics that are required as that have been presented from the previous colleagues. So this is to consider appropriate PPE, proper and hygiene practices, of course, following the continuum of care, like the WHO 5 moments for hand hygiene, and of course here for the person himself who is affected, to consider covering his lesions and having the medical mask. And of course, that's a very important element of the waste management that we kick in, especially when we know for Africa, there is also already the culture of placenta pits, for instance. We can use that to encourage people to burn and bury their waste. So there is no contact between the waste and animals and even kids that are playing around. And yeah, so in a nutshell, those are the elements that we use to as a rationale to advise countries to consider at least having home-based care and home isolation in this outbreak. Thank you.
Great. Thank you so much, Andy. That was really clear. And as you say, it's about being practical and still trying to keep safety under the conditions of a high caseload and the stigma, which is really important point. So thank you for that comprehensive response. So the next question is going to William Carter from IFRC. William, nice to see you. And for you, the question is, as an implementing partner, how does IFRC plan to support operationalizing home care and isolation of persons with mpox in low resource settings? Over to you, William.
Thanks so much. I hope you can hear me clearly. Great. Before I answer that, I do want to kind of give a little bit of a compliment to the team. We were talking about this. As far as we can tell, this is the first time we've seen guidance written like this. I always kind of sympathize for the WHO that they have to do normative guidance that works everywhere, and we all know that there's no such thing. So I know they did something similar for Gaza and OPT, but doing this for broader, I hope this shows a new way forward of producing these kind of documents for things. For this kind of guidance where we don't have everything, and we don't want to make the perfect the enemy of the good. In talking to my colleagues about how we're dealing with this, I do have to say, and this has probably been discussed in the chat, but it is a little bit of a bottleneck not having it in French yet for us, and so we need to kind of get past that. for very obvious reasons, because we're working very hard in those countries. So yes, so IFRC is the umbrella organization for the national societies, and it is those Red Cross, Red Crescent national societies that are often on the front line as community workers, and all of those tasks that were listed in terms of what a community health worker looks like. It's often someone wearing a Red Cross pinafore doing that. So we are quite involved in that. If you do look at our plans, and our plans are available, you'll see sometimes, so I just wanted to give this kind of word of caution that sometimes we use WASH and sometimes we use IPC, or a blend of both. If you're looking at our plan and you don't see one of them, don't think that we're not doing it. It might just be a terminology issue, and like I say, different national societies kind of classified under different areas. For us, the big area in WASH that we're doing this is of course hand washing, but a couple points worth mentioning there that I think should be of interest. One, don't overcomplicate it when it comes to hand washing. Just having a lot of hand washing stations is often one of the best ways to do it. Public health schools can get quite complicated on the psychology of hand washing and all those things, but I think we often find, particularly in a disease outbreak, if hand washing is easy, that tends to be a really good way to increase it. That said, that's easier said than done, and there have been a lot of issues in terms of provision of water for hand washing and some of the other activities that we talk about here. And there have been national societies and others that have kind of gotten dragged into water trucking, and we all know getting dragged into water trucking is easy. Getting out of water trucking is extremely difficult. So that's a real problem, and I think we internally have limitations and kind of silos in terms of our funding. We know our donors have this as well, and I would just urge anyone who's overseeing some funding on this, please try to break down those silos between that acute emergency funding and funding for longer term activities, because that's what we need here. We do need water supply infrastructure. I know that sounds like a long-term developmental project, but we need it now. And I would just say from the IFRC, we do have recent experience in rehabilitation and establishment of water supply at the pace that you need to see in an acute emergency, with the sustainability that you prefer. So I just urge anyone at any level in terms of being a donor, please try to break through those barriers, because this is going to be a problem, particularly in camp settings. We need water infrastructure if you expect us to do hand washing. And the last thing I'll just say is on laundry. This is not one of our normal activities when it comes to WASH in terms of promoting, but we are getting more engaged in that. Again, same problems of water infrastructure, but I would say that if you see a national society and they're more on hand washing, looking at that laundry issue, because we heard in the guidance that how important that is for us and for other traditional WASH implementers. That might be a slightly new thing, so we need to make sure that that goes into the messaging package, but more importantly, that there actually is water to do that. So I'll leave it there, but thank you so much.
Thank you, William, and some really important points there, particularly around the sustainability and using the entry point of an emergency to try and advocate, particularly with donors, around the water infrastructure. And as you say, in the context of IDP camps, this is critical, and that is one of the hotspots for the community transmission of mpox. So thank you for that. And it is challenging when there's so much pressure, but if it's not done now, then it might be a missed opportunity. And also thanks to IFRC for the work that they're doing and supporting the Red Cross on the ground. So thanks for all of that. As far as the French version, well noted. And we're hoping that it will be available in approximately about a week's time. So fingers crossed, but very well aware that that's a critical next piece that's needed. Thank you so much, William. So the next question will go to our US CDC colleagues, to Janelle Franklin, who's an epidemiologist. Janelle, welcome, and thank you for joining us today and for all the support that US CDC has been providing. So the question for you is, how should health workers manage their PPE when visiting households? Should they substitute PPE? Over to you.
Thanks so much, April, for this great question. It's an important one. When healthcare workers are performing home visits, it is very important that they protect themselves and work to prevent further spread of transmission using multiple measures. And PPE is one of these key multiple measures to use when entering the isolation space of a person isolating and receiving care at home, and when interacting directly with them. In close coordination with local health authorities, health workers should prepare, check, and take with them all needed clean new PPE before the home visit. And it should be properly donned before entering the specific isolation space or interacting directly with the person suspected or confirmed to have mpox. I know this has been discussed a lot during the presentation. After practicing hand hygiene, which as mentioned can be alcohol-based hand rub, health workers should don a gown, then a respirator, such as an N95. Third would be eye protection, and finally gloves. And as mentioned, if PPE is not available, Vicky discussed this, health and care workers should not enter the household of the person suspected or confirmed to have mpox, and instead focus on making observations from outside of the isolation space and having conversations and interacting with that dedicated caregiver from a safe minimum 1 meter distance from the person with mpox. Also, when the health worker is in the isolation space, the person that is suspected or confirmed to have mpox should wear a mask, a medical mask, or a fabric mask as an alternative, and cover their lesions whenever possible when that health care worker is visiting. And as mentioned, they can use personal clothing to cover their lesions, and again, a well-fitting fabric mask as an alternative. These alternatives can also reduce the total amount of waste produced when providing care at home when municipal waste services are not available, as has been discussed. After care and observations have been made, the health worker should then carefully and methodically remove their PPE, and it should be disposed of in a waste bag that is securely tied, as our speaker Pierre mentioned, again, for municipal waste disposal if possible. Healthcare workers should thoroughly practice hand hygiene immediately afterwards. That's really important before leaving the home. So a couple of key messages just to pull out from this. Access to PPE is really important before arriving at the home. Training on properly putting on and taking off PPE is really important, as well as hand hygiene, when to do it and how to do it out in the field. And then when possible, reducing use of PPE when observations and discussions can be safely held outside when that is possible, given the care of the person isolating at home. So that's it from me. Happy to answer any questions, and thanks very much for that important question.
Thank you, Janelle. Some really, really important take-home messages. So thanks so much. One in particular around the preparing and taking with the PPE. It's something that can easily be forgotten. And then, of course, once you're at the home, it becomes a challenge. Secondly, around the training, I think some of the experiences from colleagues in the field is that because there are multiple outbreaks, the type of PPE that people should use sometimes can be confusing. You know, if there's cholera is happening, mpox, there's been COVID. So training on what PPE to use and how to put it on and how to take it off is critical. And then finally, your comment on hand hygiene, which is really the one key intervention in the middle of everything else. If there's one thing you can do, because of the way that mpox is transmitted through contact, if you wash your hands afterwards with soap and water, alcohol-based hand rub, or chlorinated water, it's really the key intervention for controlling transmission. So thank you so much for that. Okay, so we have time for one more question. So it's my pleasure to ask Maggie Montgomery from the WASH team within WHO. So the question for you, Maggie, is how should the waste from a household be discarded when there's no centralized municipality service? And is this waste infectious? I saw that Janelle touched on it, so it's a great segue into you. Over to you, Maggie.
Great. Thanks so much, April. And yeah, really important question. I'm going to start with the first point, is trying to minimize the amount of waste that's created in the first place, right? And I recognize that many of these places where mpox is spreading, there's very little waste that the households themselves are generating. But when the response comes in, right, all of a sudden the PPE, the vaccines, all the treatment can generate a lot of waste. So I challenge all the organizations and all the responders to think about how they can, purchase things that have less packaging, how they can use only the PPE that's needed. And, Janelle touched upon those essentials, but not more than what's needed. That's first. Second, upfront, and that's involved in the planning. And, William emphasized a lot the importance of making sure and thinking about investments in infrastructure, but really to advocate for that waste monitoring and those waste investments, right? So I also recognize it in many places they won't have that municipal waste, but there are ways to engage community organizations, community groups, right, to start some sort of waste collection and to at least invest in the bags and the PPE that is needed to safely collect waste at the household level. Of critical importance is that once waste is generated, that it's protected from any exposure to human and animals, right? Vicky talked about transmission, and there's other risks that this waste has, not just for monkeypox, but sharp objects, if there's any kind of like bodily fluids or other things. So it's really important that it's kept away. Ideally, it can be buried. We're not asking households to dig a new hole every day, but it's obviously much more sensible to dig a much larger pit, and that pit can be covered each time its new waste is added, similar to how you would manage a landfill. Where you site these pits is really important, right? We don't want to be contaminating water sources or other things, so making sure that they're downhill from any water sources and away from areas where it could get washed away, or that there could be interference from animals or especially children. Hand hygiene, and we've heard that a lot today, but it's really important after waste is managed that proper hand hygiene is done. So yeah, these are all important questions. On your last point, is the waste infectious? Well, we've seen the data about the efficacy of common disinfectants for mpox in the laboratory, and they're quite efficacious. So the likelihood that this virus is lasting a very long time on waste, we don't have that data per se, but I think we can be fairly confident that it needs to be treated if it's coming from a patient as infectious waste, and it needs to be managed as safely as possible. But we shouldn't be, we should make sure that we're managing our time and attention to the most important risks. So back to you, April.
Thank you, Maggie, for taking on that challenging question. It's always challenging in the context of healthcare facilities, but even more so in the home settings to manage waste. And as you say, the first key point is to minimize the waste generated, and also how to manage by burying it. I think is very pragmatic. So thank you for all of those comments. So we only have a couple of minutes more before closing. There is one more question, so maybe I'll put it out there in case any of the panelists would like to volunteer. This is a question that has come through as well, and it is, what measures can be considered to empower families and persons at home with mpox when implementing these guidelines? For example, with the approach to home clean and disinfecting. So what measures can be considered to empower the family and persons with mpox to implement these guidelines? Anyone would like to take that on? Any of the panelists or the speakers?
Maybe I'll just quickly kick some ideas off, and other panelists and speakers, please jump in. I would say knowledge is power. So it starts with strong training and reinforcing messages from health workers that are visiting the home spaces. And then reinforcing those messages through positive messages. So when you see something positive that the designated caregiver or that the household is doing well, I would say pointing that out and noting that with them is really important. It can help to encourage that behavior long term. So those are just a few ideas. And then, of course, there are civil service organizations around the community that can bolster care at home as well, safely from a distance, not entering the isolation space, of course, but they can support empathetically support care at home or just more well-being, not care at home, but well-being again from outside the isolation space from afar. Thanks.
Maybe
Great,
I can add.
thank you. Yes, Lester, over to you.
Yeah, thank you. Very much agree with Janelle's points. And also we emphasize the importance of risk communication and engaging with communities. So it is very important that our community health workers and even health professionals, community care workers, like doctors, nurses in the communities, have knowledge and skill on how to really work with individuals, with the community members, with families, through building trust, communicating, and monitoring, and other activities in community engagement. Janelle also mentioned the importance of other partners in the communities, like community civil societies, other community organizations that we can engage with to build, to strengthen our IPC measures. Thank you.
Thank you so much, Lester. Yeah, particularly also, as you say, other partners in some of these settings, as we know, there is different crises going on, and particularly in the context of humanitarian crisis. So there are many different partners, and to leverage those networks that are already established and have entry points and trust. So thank you for that. Okay, with that, I'm gonna hand it back to Sophia to kindly close this session.
Thank you, April. Thank you for chairing the Q&A session, and to the panelists for this important discussion and for sharing your insightful perspectives. As we're coming to the end of our session, I will wrap up by saying thank you very much to all our speakers today, the WHO colleagues who have worked on this, and the EPIWIN team. Finally, thank you to all of you for coming and for your questions. The recording of the webinar will be available at the EPIWIN website. An EPIWIN Digest, a slide set with key messages on this topic, will be published shortly. If you want to keep updated on future EPIWIN webinars, recordings, and presentations, and the EPIWIN Digests, please subscribe to our mailing list. Both links will be appearing in the chat. We hope you will join us for the next webinar this Thursday, October 31st, on Global Public Health Intelligence, WHO Operational Practices. Details are posted on the website and sent to the mailing list. Thank you again and goodbye. See you next time.
Thank you all. Bye.
Bye. Thank you.
Thank you very much.